Mm. That's all right. Mm. thousands. Lunch is pork, so I'm not gonna eat it. CBC.
And closer towards automation. What does this mean for the average working individual? What would a universal basic income give them?
Well, it gives them some assurance that in hard times there's something there to backstop them. I mean, much like what has happened during the pandemic, the CERB, in fact, is a basic income program, and what did is it guaranteed that people wouldn't lose their houses, would they be able to keep food on the table, would be able to maintain their mental and physical health so they could continue in the labor market in the future. So I think for a large number of people, this isn't just people who are in poverty right now, it's people who might be in poverty in a month or a year because the job they have right now disappears in a month or a year. So I think this is something that probably could benefit probably the bottom half of the population, but it also begin reversing a trend that has been really strong in the last 30 or 40 years to change the distribution of income in a way that's increasingly less fair. Those people at the top are claiming a much bigger share of the income. Those people at the bottom are getting much less. And a basic income can be one small
Lana Jean Lochner Lansford says she knows
I think we need better
the woman
labor
speaking
laws that
now.
allow people to organize unions. I think we need these other kinds of social supports that we talked about, dental plans, drug plans, etc., to give Canadians a better standard of living. You know, we're getting richer every month in our economy. Even during the pandemic, productivity is going up, and yet most people don't feel richer. And I think there's a problem with how our society and how our labor market's organized at the present moment.
Okay. Wayne Luchuk, an economics professor at McMaster University. Thank you so much for your time, sir.
My pleasure.
vaccinated.
For the past 2 days, this kindergarten teacher has lined up to try and see if there are extra doses left at the end of the day at vaccination clinics, and he'll keep doing so until he receives a shot.
If we're going to be mandated to work, then we need to have the additional protection. The situation has changed. Cases are on the rise, the variants are on the rise.
BC had planned to vaccinate all essential workers, including teachers, with the AstraZeneca vaccine, but that rollout is now on hold because of concerns that the shot could be linked to rare blood clots. Instead, the province is now focusing only on hotspots. In Ontario, some teachers in Toronto and Peel, where there's high transmission, will start to get their shot this week. But in Niagara, the health region is moving to vaccinate all of its teachers.
Wednesday's the big day, yes.
Tina Lisi knows how dangerous the virus can be, as her brother-in-law, a retired firefighter, died after contracting it.
It was quite a shock. It made it very real that this is very real thing that's happening. So couldn't be happier to be getting vaccination.
In New Brunswick, teachers started getting their vaccine last month, but elsewhere, educators are still waiting.
We wish we could vaccinate teachers and everybody as soon as possible, but it depends on supply.
Alberta is distributing 400,000 rapid test kits to schools, while in Vancouver, schools are getting 1,200 kits. These tests can be done at home, then taken to a lab.
We realize there's a lot
Ooh,
of
no.
anxiety and concern, and we want to make sure that things are as easy as possible for families, kids, and schools.
Because even though nearly 1 million people in BC have received their first dose, cases are still surging. Briar Stewart, CBC News, Vancouver.
As a 13-year-old, I would go to school, I'd come home, I'd play computer games. I was someone who loved to eat junk food.
Growing up in New Brunswick, Jane Thornton was headed in the wrong direction.
It would have been very easy for me to go down a path of smoking, drugs, alcohol, that kind of thing.
Today, Jane's a long way from that. This is how she kicks off her day. What turned her life around? An award that was started by Prince Philip.
The Duke of Edinburgh Award. So I enrolled in a critical time in my life, and without it, I certainly wouldn't be where I am today. It's essentially launched me on a completely different career path, but also on a path in sport that I wouldn't have imagined.
And the Canadians in lane number 2.
Jane went all the way to the Olympics and placed fourth in Beijing in 2008. She credits her transformation to the discipline and support she got doing the Duke of Edinburgh Award.
That was the trigger that really set everything off the right direction. I certainly would not have attained that really unique opportunity of representing Canada at the Olympics.
She's a Duke of Edinburgh Award winner.
Had I been able, as an older me, to talk to the 13-year-old and say, listen, just get into this and, you'll go to the Olympics, think that 13-year-old would have just said, you're crazy, like, who are you, get up.
It was teenagers Prince Philip had in mind when he came up with his award in 1956. His goal was to motivate them to become better people. To do that, they have to volunteer, go on an expedition, learn new skills, and maintain their physical fitness. In Canada, 500,000 kids have participated.
I'm going to tell you a little bit about my story.
But the award is not just a thing of the past. Today, thousands of Canadian kids sign up every year, like these teenagers in Charlottetown.
All right, my name is Joelle McPhee, and I actually went to this school, and I did the award a long time ago. I was a pretty shy, nerdy kid, and I didn't really do much outside of school and hang out with friends. And
Joelle uses her own experience to get the kids interested in the award. A lot of teens are just like she was, in need of a little encouragement to pursue their dreams.
I knew that I wanted to leave PEI and go to school in a city, and I knew that I'd heard that the Duke of Edinburgh program would help my chances at a scholarship and school applications.
That's why Joelle decided to try for the award. And she had no idea it would lead her literally to the edge.
I went rock climbing, and I remember being on a rock, just completely terrified, and just thinking to myself, who are you? What are you even doing right now? And it was this adrenaline rush, and I think about, all the things I've done since then, You know, I climbed Machu Picchu with a friend last year. Like, it's just something that I think I've realized, you know, when you can push yourself and you get through it, it stays with you. So when it came to university, I actually ended up getting a full scholarship to my top choice in Canada.
What Joelle learned because she lived it is how much a teenager can benefit from structure and a little push. That was Thompson Egbo's story. Today he's an accomplished pianist, but his life wasn't always easy. His parents brought him to Canada as a little kid from Nigeria.
You know, for me, the Duke of Edinburgh Award is a very crucial piece in my life. You know, if I think about my life without the award, there's a lot of opportunities I would have missed out on.
Today, Thompson is dedicated to paying it forward.
I look out for kids because, you know, when I was growing up, I had two really, really lovely parents. I had the Duke of Edinburgh Award and was able to, say, blossom and develop into the person I am because of them. And I helped because I saw a lot of kids who didn't have that. Good job, buddy. And so, you know, one of the reasons why I give back is that I think, you know, early on, if you know, a few more kids can kind of get into some of these programs, it may just kind of change, you know, could be that butterfly effect, right? That changes the whole world for them. Those are the opportunities that could really, for some kids, mean life and death, but also could just mean, you know, a different type of life, contributing to the world and their own community in a different way.
It would have been impossible for Prince Philip to know how much his award helped all the kids who've taken it. But he wasn't just a figurehead. Whenever he could, he handed out the award himself. That's what happened to Paul Wynne. Today, he chairs Alberta's COVID-19 vaccine task force.
The memory of meeting the Duke, it was very powerful to me. It just kind of opened the world for me at the age of 17. I have very fond memories of my journey through the award. I would say it gave me kind of a toolkit for life. It gives you perseverance, determination, a sense of community.
When Paul went to his award ceremony, Prince Philip helped him make the biggest decision of his life.
I was an Army cadet. I was thinking about joining the Army. My late father was a Second World War veteran. And although I think he wanted me to join the Army, certainly wasn't forcing me to by any means. But I specifically remember receiving the award, and the Duke kind of looked me up and down. He didn't congratulate me. He just said, "Young man, you should join the Army." And I did, and I was fortunate enough to command the Canadian Army 30 years later.
In an organization as large and diverse as the Canadian Army, Paul Wynne rose all the way to Vice Chief of Defense Staff, the second highest rank in the Canadian Armed Forces. Prince Philip, the Duke of Edinburgh, is gone, but his award will live on and continue to change the lives of youth across the country. Nick Purden, CBC News, Toronto.
Let's return to one of our top stories this morning, the dire situation in Ontario hospitals as this third wave of the pandemic reaches new record highs. Take a look at this. It shows you very clearly on a graph the record number of patients now in critical care in the province, all the way up to 605. And as you can see, because you see the first and second waves prior, that is the most since the start of the pandemic. More than a year ago. Hundreds more than the last peak in January if you move to the left. And new orders are in force now that allow hospitals to keep beds open for COVID-19 patients. Elective surgeries now canceled with the exception of the northern part of the province. Patients can be moved without giving their consent in extreme circumstances. There's another emergency order that allows healthcare workers to be redeployed to hospitals in need of extra staffing. We're going to look at this in more detail with Dr. Jamie Spiegelman, who's an internal medicine and critical care specialist at Humber River Hospital in Toronto. Dr. Spiegelman, welcome back to our program.
Thanks for having me, Heather.
Well, I'm really interested in your take on all of this, and maybe we can bring back that graph because I know you were looking at it. You can see it first wave, second wave, and then right off the chart there. As you look at that graphic depiction, 605 now in ICU beds in Ontario. What's your reaction to that?
Yeah, it's definitely true. Every wave has been different. This wave is clearly more larger, it seems, for sure, and it just does seem like that from the front lines for sure. Like we're this third wave. One being the number of patients, like depicted on the graph. The other one being enough staff to take care of these patients, particularly nursing staff.
Okay, let's break those down. Let's look at each of those separately if we could. In terms of patients, as I was mentioning, there's that order now allowing for patients to be transferred out of hospitals to hospitals where there might be space. At your particular facility at Humber River, had you had to yet transfer anybody out?
Yeah, so for the last 2 to 3 weeks, we've been transferring anywhere between 2 and 10 patients a day to other hospitals.
A day?
A day, yeah. So two on life, usually on average 2 on life support and another 5 to 10 not on life support to other hospitals who are on the medical ward. So we're for sure neck deep into this third wave for sure at this point.
Neck deep. That is a really good description, a visual of all of that. So the patients are transferring, and just so everyone realizes, this is the first time in the course of the pandemic that Ontario has made this order to transfer patients out. What about staffing? As you said, it is critical as well. What's the situation?
Yes, so definitely one of the biggest challenges we've had, and if any hospitals in the GTA and Ontario are having enough nurses to take care of these patients. There's some hospitals where underused doctors are even helping the nurses taking care of these patients from a nursing standpoint. So there's definitely a nursing shortage for taking care of these patients at the bedside. So that's universal at this point, and we're making do, and we're using extenders from other areas of the hospital coming down, but that's also causing a domino effect, obviously. If you're taking a nurse from a medical floor or a surgical floor or the emergency room to the ICU, obviously that's going to cause a domino effect in terms of having enough nurses in those areas as well. So we're definitely seeing that in our hospital.
So just to be clear, extender is someone coming in from elsewhere into the service to extend your capacity to care for patients there. So are you moving them from just within Humber River, or have you had to bring them in from outside your hospital, or even, I mean, there is a push in some circles to bring them in from outside the province?
So far we're using within the hospital system. I'm not sure what the administrative plan is to bring them from outside. I know Dr. Ford has mentioned that, and we'll see what happens. But right now we're tolerating it, although there's clearly a shortage.
Yes. You mentioned something interesting, and certainly I've been hearing and reading reports from William Osler, notably, of doctors who would not normally be working with COVID-19 patients, getting special training to work alongside critical care nurses to show up that nursing service. So how extraordinary is that?
It's pretty extraordinary when a doctor's trained all their life to do, brain surgery or gallbladder surgery or chest surgery, and now is helping to turn a patient who's critically ill in the ICU on a life support mission. So it's pretty extreme, but it's what we'll do as doctors. I think we'll do whatever it takes to help these patients.
So the worst case, as bad as it is, Dr. Spiegelman, the worst case, Ontario is already talking about this, and from the health minister we heard at the end of last week, the province is finalizing its triage protocol, what it would have to do if the ICUs are overrun in terms of deciding who gets life-saving care and who does not. How close to that moment are we now?
First of all, I don't think any physician, anyone in healthcare wants that to happen. It'd be terrible when we're deciding who gets life support and who doesn't. That's not what our healthcare system is based on. We're based on universality and everyone getting equal care. So none of us really want that at all, or even come close to that. I don't think we're that close to it at this point. I think we'll adapt as a healthcare system. We'll have these extenders. We'll bring in other people before we can come close to this like that. And it will come down to more of a political and bureaucratic decision rather than from a healthcare provider like myself. I would never decide on getting life support or not getting life support based on resources.
I think that's what they're wanting exactly to avoid, to indemnify doctors like yourself from having to make those decisions. But I remember when they first released that triage protocol the first time back in January, what a stunning moment it was. So I wondered if you thought it was on the verge of being brought back, given the kinds of numbers that we are seeing. You are getting set to head in for your shift on this Monday.
Yeah.
What do you anticipate?
I see the list every morning in our email, and when half the patients get admitted to our hospital are COVID patients, we know what we're dealing with this for the rest of the day. We know There's patients that we're treating all over the hospital. That's not only in the ICUs, but on the medical ward. So every day is a new day, and these patients vary. Like I'm looking at the list, and we've had admitted patients over the last week, ranging from ages of 22 to 99 with COVID. So every day is a new day, and we'll see what happens, I guess.
A new day. But is it likely to be a good day?
I don't know. We'll have to find out. Some days are, some days aren't. Over last week, and whenever you're intubating somebody in their 20s or 30s, it's not a good day.
No, you told about that most often the last time you were on the program talking to John. Surely there are people who are recovering and there are people who are leaving hospital, and those are good day and good moments, I'm sure, for you. But the strain that you are under, the strain that the system is under, Dr. Spiegelman, have you ever experienced anything like this in your career?
Definitely not. If you asked me a year and a little bit ago what you'd be treating, I'd be like, I'd be treating heart attacks, strokes, the normal medical problems that we treat in hospitals. We're treating a disease that didn't exist basically a year ago. So clearly we have not been under this much strain in terms of treating a disease we don't really completely understand yet. We don't really have a magic bullet to cure this disease. And we're obviously having increased numbers of it, so it's definitely challenging for us in the hospital at this point.
The numbers just keep going up. Dr. Spiegelman, thank you for the time today. Thank you for all the work that you're doing and all of your medical colleagues continuing on so heroically. Thank you. Dr. James Spiegelman is an internal medicine critical care specialist at Humber River in Toronto. Using a sponge and a small bowl of DMSO and water to apply. It's a bit like a fresh start, I guess, so the mind has sort of got away the nonsense from last year and get ready for this sort of, hopefully, new and hopefully new life.
People are familiar with very long hair, so I'll be glad to get rid of the germs.
The volcano just blew and you can see it as ashes.
Farida Nanton captured these moments after the volcanic eruption Friday, but this was just the beginning. Another explosive event came this morning. Farida's sister Sandra in Montreal has desperately tried to stay in constant contact, but it hasn't been easy.
It went out.
Yeah. Back on the line, Farida describes what she saw.
This one this morning was the biggest one so far because it was very loud and you can feel the tremors. So it was quite scary, and the lightning was flashing because there was a total blackout. But when the lightning flashed, it was lighting up the whole country.
People here now frustrated by shortages of power and water as a blanket of ash covers everything in sight. 16,000 people have had to abandon their homes. For Sandra Nanton, it's hard to watch from so far away as her family struggles.
It's very emotional too. because in a minute you might hear it's another explosion, and then that explosion could go to the worst.
The St. Vincent and the Grenadines Association of Montreal is preparing to send all the help it can. The group will hold a donation drive for urgently needed essentials like non-perishable food and clothes. And it has contacted a Canadian shipping company to deliver the supplies.
And they have given us the assurance they will take it to St. Vincent for us free of cost. So we're going to get it, call them, they'll come and pick it up, or we will take it to them, whichever is faster, because time is of the essence.
Scientists warn eruptions could continue to shake St. Vincent for days, even weeks, with thousands uncertain when they can go back home. Matamo, CBC News, Montreal.
The 2021 virtual Liberal Party convention has come to a close, and it's likely to be the last convention for the party before the next federal election. As David Cochrane reports, speakers used the occasion to contrast the Liberal Party stances from the opposition Conservatives on several issues.
I can now officially call the 2021 Liberal National Convention to order.
An unconventional convention for unconventional times. Liberals gathering virtually to act politically.
What would we have seen if Erin O'Toole and the Conservatives were in power when the pandemic hit?
That theme persisted throughout. A relentless critique of the Conservatives' views on everything from climate change to pandemic spending.
We know that the Conservatives do have a price that they could put on lives.
It was largely an exercise in sharpening their pitch for the next election, with the Deputy Prime Minister dropping broad hints about the upcoming budget.
COVID has created a window of political opportunity and maybe an epiphany, as you put it, on the importance of early learning and childcare.
And a potential star candidate dropping subtle hints about his political future.
I'll do whatever I can to support the Liberal Party in our efforts to build a better future for Canadians.
There was nothing subtle about the Liberal leader's speech.
The problem for Erin O'Toole is that he's not interested in real solutions to real problems.
As Justin Trudeau painted his main rival as out of touch.
How disconnected do you have to be to flirt with disinformation on public health and vaccines, while a deadly virus takes loved ones, friends, and neighbors? How disconnected do you have to be to refuse to admit climate change is real?
It's all about drawing a sharp contrast before the next election, and with COVID cases surging, the most likely window for that is this fall, when vaccinations should be more widespread and life can hopefully start to return to normal. David Cochrane, CBC News, Ottawa.
Let's turn now to the NDP. It's the second day of that party's three-day virtual convention. BC Premier John Horgan said his win in that province in October shows that Canadians are ready to see the NDP in power. But the party will keep the spotlight on their federal leader, Jagmeet Singh. Olivia Stefanovich is in Ottawa, and she tells us how the NDP is planning on doing that.
As this national convention of the NDP goes underway this weekend, the party is launching a new ad campaign. Starting tonight on Hockey Night in Canada, there will be a new ad featuring leader Jagmeet Singh. And unlike traditional political advertisements that we've seen from other parties, Singh doesn't actually speak in this ad, which is untraditional. The party focuses on images of working people and text to tell a story about how the NDP fought for Canadians during this pandemic, and it makes the case that Canadians, their lives could be perhaps even better if they support Singh in the next federal election campaign. And this ad is really targeted towards young people. That's the voting age group between 18 to 40. And the party is trying to speak to voters who might be disappointed with the Liberal government, who perhaps voted Liberal in the past, but didn't get everything that they had hoped for, and they want to try something new. Those are the voters that the NDP is trying to win over through these new ads. And we're going to see Singh a lot more, not only on these TV and radio ads, but also online. Singh has a major presence already on social media, and he's about to get even more visible through other means. The party has lots of plans for this, but the challenge going forward, Natasha, will be how to translate those digital hearts, those likes, into votes, especially since the party is targeting an age group that doesn't traditionally head to the polls in large numbers. So I spoke to campaign insiders, some strategists about this. Here's what one of them had to say.
Rather than trying to chase votes directly from younger people, we only need to find a small subset of hyper-engaged young people, give them disproportionate access, disproportionate skin in the game, perhaps even disproportionate titles on the campaign, so that they can be the standard bearers to their social network. Because if they reach out versus we as a campaign reaches out, there's a significant difference.
So Natasha, I asked our colleague Eric Grenier, who's CBC's polling analyst at the Parliamentary Bureau, to dig up the latest numbers on the age group of 18 to 34, just to see how the parties are doing when it comes to attracting that young vote. And it shows that although the NDP is popular among young people, the party still has a bit of work to do. The NDP is currently trailing the Liberals by 6 points.
CBC's Olivia Stefanovic in Ottawa. Meanwhile, Erin O'Toole participated in an annual meeting for Canadian Conservatives. The Conservative Party leader said that if he becomes the next Prime Minister, he will have a different approach from the Liberals for restoring the economy.
So we're not only opposing the ideological approach from Mr. Trudeau, the reimagining exercise you're talking about that he refers to building back better. That's what Mr. Trudeau and his small advisors thinking.
Feel good. So I turned my own design into a business. My product is bow tie. My brand is self-expression, and I am mostbowsminty.com. Make a different future. Start different at GoDaddy.com.
To private sector union leaders, we have to be the party for people that want to work, that want to get community families back on track. Not reimagining, not serve for forever through a UBI and everything is free while the private sector is being hollowed out. It is a recipe for a poorer future.
O'Toole also repeated his vow to cancel the federal carbon tax if the Conservatives take power.
It wasn't even a thought that we would be dealing with this catastrophe.
Lauren Barmash-Viator's entire family contracted COVID-19. Her father died, her mother needs help breathing, and she continues to suffer from long-haul symptoms.
This was the variant, so it hit us very hard and very fast.
The COVID-19 virus is trying to bring Ontario's hospitals to their knees.
Late Friday, the province added 2 emergency orders.
I'm going to stop recording and upload this.
Patients elsewhere without their